Lost the flag. Well, good afternoon, everyone. We had sad news earlier today. We learned that former Ohio Supreme Court Justice Andy Douglas had died. He served on our state's highest court from 1982 to 2002. He was very proud of the fact that he was from Toledo, loved Toledo, loved Northwest Ohio, and loved Ohio. Even after he left the bench, after he retired from the Ohio Supreme Court, he continued to practice law and be involved in the law. He's also executive director of the Ohio Civil Service Employees Association. So we extend our sincere condolences to his family and to all of his friends. Last week, leaders from Ohio's Children's Hospitals shared with us the alarming trend they're seeing during the current COVID-19 surge. If you recall, we heard directly from pediatric healthcare providers that more children are sick. They're seeing more sick children in their hospital, and not just with COVID, but other respiratory illnesses and other pandemic-related issues, health issues. And it's causing a strain on our children's health system. When we look at the data, when we look at the facts, that certainly the data confirms this. Since August 15th, there have been over 42,000 confirmed or probable cases of COVID-19 among school-aged kids in Ohio ages 5 to 17. The 27 days with the highest number of cases per day throughout our entire pandemic for children 5 to 17 have been since school began this year. That is a shocking figure. And at 11 o'clock this morning, I received a letter from the Ohio Hospital Association outlining the dire conditions facing our hospitals who are on the front lines of treating patients with COVID-19. And they were specifically talking about our adult hospitals. This is a copy of the letter that I received today at 11 o'clock. Certainly, the hospitals are doing everything they can to help these patients. They're facing a severe nursing and staffing crisis. In essence, their letter tells us that there are more patients, but fewer healthcare providers to care for those who are in the hospital. And I would like to read just some excerpts from the letter. I think the letter is been made available to the news media, but just a couple excerpts, and I quote, "For example, in mid-July, Ohio hospitals were treating 200 COVID-19 patients. Today, that number is 3,702. That's a 16-fold increase in just 2 months," end of quote. Further in the letter, it says, quote, "In mid-July, 1 out of 100 patients in the hospital were being treated for COVID. Today, that ratio is 1 out of 6. Today, 40% of patients on ventilators are being treated for COVID." The letter continues, "In some parts of the state, the situation is certainly more dire. In rural Southeast Ohio, half of hospitalized patients are being treated for COVID-19. And two-thirds of the patients in the intensive care unit are being treated for COVID." The strain is not just impacting COVID-19 patients. The letter goes on to tell us that the strain is impacting every patient in the hospital and those who want to go to the hospital. And I quote, "The Ohio Hospital Association again says," and let me quote it, "When hospital resources, including staff, are stretched so thin, hospitals' ability to care for patients can be compromised. Some hospitals are diverting patients to other emergency rooms. Others have patients facing extremely long waits, and some are having to cancel certain procedures to redeploy staff, end of quote. Doctors and nurses from hospitals across the state warned us just 2 days ago on Tuesday about what is happening. And if you recall, Dr. Susan Bennett from the University of Cincinnati Health System said in part, and I quote, that these cases are, quote, creating scenarios that no one wants to think about where we do not have the space for patients who would otherwise benefit from receiving their care at our large academic medical centers. Dr. Alan Rivera from Fulton County Health Center said they were in a crisis mode. He described an increasing number of patients who are younger than before, and he described nurses who are working longer hours or who have simply left the field altogether. Also, Terry Alexander, a nurse with Summa Health in Akron, said the situation is tragic because it is preventable. She said, and I quote, "We live in a culture that has never experienced coming to the hospital and getting turned away." And I think people can't fathom what that's truly like until it's them or their family members who are coming in and getting turned away, end of quote. Vaccinations remain our ticket out of this pandemic. Vaccinations are the way that we stop our hospitals from being overcrowded. It is the number one way that we can do this. They remain. Vaccinations remained clearly the most potent tool we have to protect Ohioans from COVID. The vast majority of the strain that's been described by our hospitals, both children's hospitals and now with this letter today are adult hospitals. The vast majority of that strain is preventable, and it can be prevented simply by vaccinations. So let's look again at what the facts are. We've done very well in vaccinating Ohio's older adult population. The percentage of first doses for Ohioans over 40 years of age is 73%. So over 40, it's 73%. And if we go up to 65 and older, that number is 84%. So both are pretty good numbers. Conversely, however, if we look at younger Ohioans, we don't find such good news. We know that eligible younger Ohioans have far lower vaccination rates. The rate of first doses for Ohioans between 12 and 25 years of age is just 46% statewide, 46%. But we also know that there are many, many communities across Ohio where that number for the age group 12 to 25 is vastly below 46%. This age group has the most room to grow in terms of getting vaccinated. And with the Delta variant in our midst is the group that we are concerned, frankly, will miss in-classroom learning opportunities if they get or exposed to COVID-19. Keeping our children in school, in person, is a top priority for this state. It is a top priority for parents. It is a top priority for our schools, for our teachers, for our administrators. It is so very, very, very important. And the best way for those who are 12 and above, the best way to stay in school is to become vaccinated. The best way to run cross country on Saturday morning, if that's what you love to do, is to become vaccinated. The best way to play football on Friday night is to become vaccinated. The best way to be in theater or debate or whatever you love is to become vaccinated. Let me again point out that students who are vaccinated do not have to quarantine when they are exposed. Students who are vaccinated do not have to quarantine when they're exposed. So that is the ticket. It is the ticket really meaning that they won't have to miss out on school. They can keep participating in whatever extracurricular activity that they love to do. Today, I am pleased to announce Ohio Vax-to-School program. Today, I'm announcing the Ohio Vax-to-School program aimed at this group of Ohioans, a group of Ohioans who can be vaccinated now, but where the rate of vaccination is very low. This Vax-to-School program will be open to all Ohioans aged 12 to 25. And it will be similar to the scholarship portion of our successful previous promotion, Vax-A-Million. Under the Ohio Vax-to-School program, vaccinated Ohioans in this group can enter a drawing. And what they can win is one of 5 $100,000 scholarships. So 5 of these $100,000 scholarships are going to be offered. They can use it to go to an Ohio college or university of their choice. They can use it for career or technical education. They can use it for job training. They can use it for any kind of education that will help them. In addition to these big winners, we also will offer 50 scholarships of $10,000 apiece. 50 scholarships of $10,000 apiece. And again, these can be used for career or technical education. These can be used for job training. These can be used for college. These can be used for postgraduate work. Opportunities are endless. Ohio Vax-to-School will be funded through existing coronavirus relief appropriations. The Ohio Department of Health and the Ohio Lottery will hold a press conference in the next week to give more details about exactly how this will work. The Ohio Vax-to-School program not only focuses on eligible students in middle school and high school, but as you can see, also our college students as well, where we also need to make progress in vaccination rates. We selected the cutoff age of 25 to account for some non-traditional college students, as well as students seeking postgraduate studies. We also wanted to make sure that Ohioans who intend to pursue career training outside of college can use these prizes for those purposes. Any Ohioan age 12 to 25 is eligible for these scholarships for college or career as long as they've received their vaccination by the time they enter for the drawings. And we'll be announcing in the future when you can go up and enter. But to state the obvious, everybody who has already been vaccinated is included. And if you want to be vaccinated anytime going forward, also, that will enable you to enter this and be eligible. So I urge our younger Ohioans who have not yet received a first vaccine dose to do so. It will certainly protect you. It will help protect your friends, your family. It will also make you eligible after you sign up for a scholarship. And finally, getting that vaccine will help keep you in school. Let me turn to a question I've received from a number of schools, and that has to do with the growing problem, not just in Ohio, but across the country in regard to bus drivers. This is an issue I've heard a lot about. I talked today to Attorney General David Yost about this to see if there's anything that working with him that we could do. The Attorney General has promised that he will prioritize in regard to background checks bus drivers, school bus drivers. As we analyze this, and we're still in the process of seeing what else that we can do, but one of the things that we heard is that there is a backlog of someone who wants to get their CDL license, and there's a backlog of doing the background check. And so what we want to do is collapse that backlog. We want to put them to the head of the line. And I also discussed with the Attorney General how we could, for everybody who is waiting for a background check, whether someone who wants to be a coach, someone wants to be any other kind of occupation, how we could collapse that time. And the Attorney General is looking at that. I've committed that we can provide some additional funds to the Attorney General's office to be able to hire additional people to get this backlog brought up to date so that that will not be an impediment. Attorney General and I also talked about prioritizing really people who are essential as we try to deal with this COVID. Bus drivers, educators, nurses, other healthcare professionals. So they will be prioritized in regard to the background checks. That's the short-term solution. The long-term solution is to collapse and get rid of that wait period for that background check. I've been told by some people that it's several weeks. The Attorney General is committed again to go into a short-term solution as well as a long-term solution. That will not solve all of the problems in regard to bus drivers, but it was one of the things that we looked at that we could actually take some immediate action and we believe get some results and speed some of this up. We're also looking at the other options and other things that are available. I know that there's been some mention of using the Ohio National Guard. We're still examining that, but caution I would have for everyone is that whenever you pull someone in from the National Guard, they're leaving a job. These are not people who are just sitting around waiting for us to call them. They're citizen soldiers. They have a day job or a night job. Many times they're professionals. So if we were to pull in people who are legally qualified to drive a bus, they might be leaving another position, that was very, very significant. So anyway, we're taking a look at that. But I wanted to just bring everyone up to date. The fact that we're looking at this, and I wanted to inform everybody about my conversation with the Attorney General today. Let me give you an update also on the number of children in our schools, our public schools, who are masking as of today. That number is 61%. So we continue to make progress in that area. We know that getting vaccinated is most important thing, but we also know that for those children who cannot be yet vaccinated or who are not vaccinated, that masking does in fact cut down on the spread. We continue to make progress in the number of our school children who are wearing masks. Today, 61% of Ohio school children, as I said, are wearing a mask. Just to put it in perspective, on September 1, that number was about 31%. Reporting to us today, we have 2 school districts that are partially remote. Now, that might be a building, for example, closed, but would not be the whole school. In both of those cases, in both of those school districts, they were not following a masking requirement. Let me now go to Dr. Vanderhoff. Dr. Vanderhoff.
Well, thank you, Governor. As you have noted, we continue to see some concerning figures about COVID-19 cases in our younger Ohioan population. And we're particularly concerned about the school-aged children who aren't yet vaccinated, either by choice or because they're less than 12. Now, we are getting closer to vaccines being available for those Ohioans ages 5 to 11. Top-line data released earlier this week have shown that the Pfizer vaccine is safe, well-tolerated, and produces robust neutralizing antibody responses in clinical trials of participants in that age group, 5 to 11. But the vaccine won't be available until that data has been thoroughly reviewed by the medical experts who advise both the FDA and the CDC, and a green light has been given by both the FDA and the CDC. Also,